Hi there, I'm here to do a persuasive video on colonoscopies and the benefits of having them. I know when you hear the word colonoscopy, you're really excited to go have one, but I'm going to explain to you some benefits of having them. Screening for colorectal cancer, cancers of the colon or large intestine, and rectum is a proven lifesaver. Colon cancer is a cancer that screening can prevent, since it can lead to detection and removal of polyps, some of which may progress into cancer. Most individuals dread getting a colonoscopy, as I hear every day as I work in a GI lab as a nurse, and they are not happy to be there. The bowel cleansing prep includes a clear liquid diet, strong laxatives, and a high fluid intake. Many are scared and embarrassed about the procedure itself and worry about potential complications. When the patient comes into the GI lab where I'm a nurse at, the first thing I reassure them of is that I will get them through the procedure. And I'll be with them during the whole procedure and the whole process. So what is a colonoscopy? A colonoscopy is a test that allows your doctor to look inside the inner lining of your large intestine, which includes the rectum all the way to the cecum. Colonoscopy can be used as a screening test to check for colon cancer or precancerous growths. They use a thin, flexible tube called a colonoscope or a scope. They look for or helps find ulcers, polyps, tumors, areas of inflammation, and or bleeding. Tissue samples can be collected, that is called a biopsy. Abnormal growths can be removed, and polyps, which is called a polypectomy. So what is a screening colonoscopy? A screening colonoscopy is generally done at the age of 50 for both men and women who have a normal risk for colon cancer. Your doctor may recommend an earlier or more frequent testing if you have a higher risk for colon cancer. Talk to your doctor about when you should be screened or have the test done. A screening colonoscopy is a test to check for colon cancer and precancerous growths in the colon and the rectum. Other indications for colonoscopy can include, they're not limited to, early colorectal cancers may not cause any symptoms, so you may not have any symptoms. It's important to see your doctor if you do have any of the following symptoms. If you have a first degree, a parent or sibling, family history of colon cancer. If you have a change in your bowel habits such as diarrhea, constipation, narrowing of the stool, or any kind of change that's lasted over 1 week, a feeling that you need to have a bowel movement but that is not relieved by doing so, evaluation of active rectal bleeding or blood in the stool may look dark, appear dark, or if you've had a negative upper GI, which is an EGD or upper endoscopy, then they may want to investigate further and do a colonoscopy. Evaluation of, like, if you've had chronic unexplained abdominal pain, belly pain, weakness, fatigue, if you're tired, an unexplained unintended weight loss, unexplained iron deficiency anemia if no other reasons for having anemia, and if you have had an abnormal test results of a CT scan, an MRI, a stool test, a barium enema, the doctor is going to want to perform a colonoscopy. So, as stated in the mayoclinic.org, a colonoscopy is a procedure in which a trained specialist uses a long, flexible, narrow tube with a light and tiny camera at the end of the scope. It can be called a colonoscope or a scope to look inside your entire bowel from the distal rectum all the way to the cecum. The procedure is a safe, effective means of evaluating the large bowel. The technology for colonoscopy has evolved to provide a very clear image of the mucosa through a video camera attached to the end of the scope that transmits images to a video screen while the patient is sedated. We currently use fentanyl and Versed, and we can also use anesthesia if this patient is harder to sedate. The camera connects to a computer, which can be stored and print colorful images that the physician selects during the procedure. Colonoscopies can show irritated and swollen tissue, ulcers, polyps, and cancer. During insertion of the colonoscope, the object is to reach the cecum as quickly and safely as possible, as stated in Gastroenterology Nurses and Associates. During withdrawal, the object is a meticulous inspection of the whole colon. The mucosa is scanned by changing the position of the flexible tip while the instrument is slowly withdrawn, also by Gastroenterology and Associates. The bowel wall is examined for abnormalities such as ulcerations, bleeding sites, polyps, inflammation, or tumors. Direct visualization allows for therapeutic procedures such as polypectomy, dilation, decompression, and fulguration of bleeding sites. Screening for and follow-up for colorectal cancer are among the indications for colonoscopy. According to medicinenet.com, one widely accepted recommendation has been even for healthy people at normal risk for colon cancer should undergo a colonoscopy at age 50 and every 10 years thereafter, for the purpose of removing those colon polyps before they become cancerous. Colonoscopies may be done for a variety of reasons. As stated from medicinenet.com, most often is done to investigate blood in the stool, abdominal pain, diarrhea, a change in bowel habits or abnormality found on colonic x-rays or CT scans. Individuals with previous history of polyps or cancer and certain individuals with family history of some types of non-colonic cancers or colonic problems that may be associated with colon cancer, such as ulcerative colitis and having colon polyps, may be advised to have periodic colonoscopies because the risk is greater for polyps and colon cancer. How often should one have a colonoscopy depends on the degree of the risk and abnormalities found on your previous colonoscopies. According to cancer.org, the American Cancer Society, regular colorectal cancer screening or testing is one of the most powerful weapons preventing colorectal cancer. Excluding skin cancer, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. I have a friend who survived colon cancer due to early detection. He had some of the signs and symptoms listed in the speech, and he had them checked out as soon as he had them. He acted immediately due to his experience, his own personal family experience with colon cancer. His father passed away at age 40. He went through a bowel resection, a colostomy, chemotherapy, and radiation before the age of 20. It was not an easy time for him and his family to go through colon cancer again. He was intuitive and knowledgeable regarding his body and colon cancer. He didn't want to have a colonoscopy, but thank gosh he did. He took all the right steps and is currently a cancer survivor at age 30. So if you have any signs and symptoms, or if you're age 50, male or female, you want to have a colonoscopy done. Thank you.